topic on novel development in breast radiotherapy in Bangladesh, challenges in intraoperative radiotherapy by oncoplastic breast surgeon. Intraoperative radiotherapy is a specialized technique in which a precious high dose of radiation is delivered directly to a tumor bed during surgery immediately after tumor removal. It plays a crucial role in enhancing local tumor control while minimizing radiation exposure to surrounding healthy tissue. While the whole breast radiotherapy in selected women suitable for breast cancer surgery, since it is a relatively new method of delivering accelerated partial breast irradiation, about 10 to 30 gray single fraction radiation is given to lumpectomy cavity within 1 to 2 cm margin. In 70s, when the mastectomy is the main treatment for the breast cancer, but by the time in 90s, the whole breast radiotherapy for 6 weeks come to the field, and the 2000 partial breast radiation therapy for 1 week for selected patient, and in 2010 intraoperative radiotherapy is introduced for the selected patient. IORT allows increase in the radiation dose at the site of the disease and thus increases local tumor control. To decrease the dose to adjacent healthy tissue and critical structure like heart and lung. Advantage of IORT, it reducing the chance of residual disease at the site of surgery and reduce the treatment time compared to the external beam radiotherapy from 4 weeks to 1 day. In Taiwan, they introduced in 2013 5 centers, and in 2015 they used in 26 centers. Day by day they increases the IORT center. But all patients are not suitable for the IORT, and there is some criteria. It can be used for early stage tumor less than T2, and when the patient is more than 45 years, tumor should be less than 3 cm and negative margin after the lumpectomy, and no nodal involvement, and of course patient has to hormone receptor status positive. And that's why we need the frozen section examination operatively, and we used to do sentinel lymph node biopsy. This criteria, the German criteria also says the same, but few contraindication is there. They are like stage 2B breast cancer and above cannot be used the IORT, extensive intraductal component, pathological skin involvement, when and less than 40 years old patient cannot get this, and when the neoadjuvant chemotherapy needed, we cannot introduce the IORT. We have to use balloon for the surface of the skin to the balloon should be 1 cm surrounded whole cavity. There is few exclusion criteria like the pregnant woman, the pacemaker, when there is pacemaker, significant autoimmune disease, multifocal, multicentric, and non-lymphovascular invasion. We have to cancel the IORT planning when the positive sentinel lymph node is positive and when the surgical margin is positive. This is a machine, the part of the machine, and this is balloon. I have a balloon. Actually, this is balloon. We have to feed the cavity, lumpectomy cavity. According to size, we have to introduce inflate with saline, and then another introducer. We see. This is miniaturized X-ray tube, which the connected with main source of radiotherapy and give the radiotherapy to field. Actually, this is part of the X-ray source, and we use this machine in our as usual modular theatre. In this procedure, we need internal shading and external shading. Or internationally, we have to place the bed of the tumor cavity and another external. Externally, we have to use and show. Many size of balloon, 4 cm, 5 cm, according to the tumor size and cavity. And we have to feed this balloon to the cavity, not gap. No gap is allowed. And as well as no air is allowed. It is a multidisciplinary team approach. That means a oncoplastic breast surgeon of course needed, and with the help of radiation oncologist, physicist, and nurse and radiotherapist. We need. This slide shows that first of all we have to remove the tumor from the tumor breast, and then we have to place the balloon to the tumor cavity, then a suture material to place the hold the balloon in the cavity. Then confirm the margin is negative, and we have to place the device and confirm that there is no gap by ultrasound machine, and they of course measure there is 1 centimeter margin all around, and then radiation oncologists come and put a radiotherapy. It took about 15 to 20 minutes, and 20 radiation is delivered. Being a surgeon, we have many of course things that is every patient selection, the incision pattern, and oncoplasty happen or not by IOT, of course. And we have to select the patient, and tumor position and tumor size with inclusion criteria is we can maintain. And we of course the incision, the oncoplastic breast surgeon, which is the aesthetic they can use, because the machine is movable, mobile machine we can use. এটা আসলে আমাদের একটা মেশিন, আমরা মেশিনের ওখানে একটা ভিডিও করেছিলাম, যেমন এই বেলুনটা আমরা এখানে যদি বাতাস দিয়ে ফোলাচ্ছি, এটা হচ্ছে ফোলানো হয় স্যালাইন দিয়ে, এবং এটা সাইজ মতো কভার করা হয়। এই স্কিন সেলাই দেওয়ার পরে দেখা যাচ্ছে যে সেখানে আমরা স্টেরাইল একটা জ্যাপিং দিব, সেই স্টেরাইল জ্যাপিং দেওয়ার পরে ভীষণ অন্তর্ভুক্ত তিনি খুবই আকার শুনছেন ওনারা পরবর্তীতে এখানে কিন্তু আমরা দিন তারপরে মানে পাবেন হচ্ছে রেডিয়েশন সোর্স এই সে সম্পর্কে একটু শর্ট ভিডিওতে দেখানো হচ্ছে যে হ্যাঁ এটা আমরা ঢুকানোর পর এদিক দিয়ে আমাদের হচ্ছে রেডিয়েশন সোর্সটা ইন্ট্রোডিউস করা হয়। এখানে আমরা ক্যাভিটিটাকে মেজার করার জন্য পলিস ক্যাথেটারটা ইউজ করতে পারি, যে বেলুনের সাইজটা কত, বেলুন থেকে একটা এক্সপেন্সিভ যে আমরা কোন বেলুনটা ইউজ করবো এবং অন টাইম ইউজ, সেজন্য আমরা পলিস ক্যাথেটার এটা ইউজ করে থাকি। তারপরে আমরা হচ্ছে সেলাই দিই, এবং এখানে বলা হয় যে বাতাস যেন না থাকে, তাহলে রেডিয়েশনটা ঠিক মতন হয় না। দিস ইজ দ্য মেশিন that we have to use. Bangladesh have the machine, but still we are not using this because of installation program. Recently we should soon will use. This is the feature that after putting this after putting this balloon, we have to suture up a temporary suture, and we know that surgery field is sterile field, and so we have to drap again another draping, and invite the radiation oncologist. This is ultrasound machine measuring the thickness of the skin surrounded by the balloon. That there should be 1 centimeter. And after that we use the extra dabbing sheet, because now it is a sterile field, and radiation oncologists come and introduce the radiation source by this way, and this will reach this tip and deliver the radiation therapy, and the radiation oncologist doing their job. This is external shield placed here, and after that when the job is done, then radiation oncologist leave the OT, and the surgeon can again this field and remove this draping sheet, and it is again become a sterile field, and then balloon deflated and remove this balloon, and by the oncoplastic technique surgeon close this wound. And this is the final figure. Tips and tricks that this balloon never touched by a clamp, because it will be destroyed, and we can use iron, and actually we have to place a suture, a repositioning bridge suture we can use for closing this initial wound. Everything have pros and cons. The pros is that we reduce the radiation time 3 to 6 weeks to 1 day, And many women did not have the chance to come 5 days in a week. So distance of this home and the center is far. So if it is on day, it is suitable for her. It is less expensive because the timing of the patient, but not actually expensive. And this is not a newer technique because in 2010 it's introduced in the world. IOT does influence the surgical approaches in the majority, even with the benefit for the patient. It prolongs the surgery time relevantly, but it spares much more time for the patient afterward. So in our country, we hope that IOT can be introduced our country, and if it is reusable, we can give less the expense. And this is my team. Thank you.